This is Optometrists Building Empires, and I'm your host, Ankit Patel. Each week, we'll explore the journey of multi-practice ownership and leadership in optometry. Join us for insights and strategies from the top minds in our field. This show is sponsored by My Business Care Team. My Business Care Team helps your office increase revenues, reduce costs, and reduce staffing headaches. Let's build your empire together. Today's guest is someone I'm excited to speak with, mainly because I think she's our first female guest that we've had on the show. She's a therapeutic optometrist. She practices in glaucoma specialty. She co-manages LASIK and cataract surgery patients with local ophthalmologists. She specializes in difficult contact lens cases, including keratoconus and post-corneal transplant, using advanced technology to really collaborate with local ophthalmologists to prevent disease progression. She's also got a passion for working with kids and going above and beyond to really identify issues that can lead to eye strain and headaches. She likes providing myopic control as well as other pediatric specialties. She's the owner and optometrist at Texas State Optical at Champions in Briar Grove. Please welcome Dr. Ayesha Butt, a leading Houston optometrist and visionary practice owner. Ayesha, welcome.
Hi, Ankit.
Again, I'm excited to speak with you because I think you're going to bring a slightly different perspective to the podcast today.
Thank you so much. Thank you for inviting me and having me here.
So let's kick it off. First question that we like to ask everyone. What was the most important thing that helped you grow your empire?
The biggest thing in my life has always been consistency, not being afraid of failure, whether it means trying my exam multiple times or trying something new and it didn't work. That didn't discourage me. You get up, you dust off and you start again. And I think that's very important in optometry. In patient terminology, if you focus on it, focusing on that one thing, that one patient that's in front of me, patient experience is very important. And it's always been. In my 10 years, I've always put my patients' needs first instead of what I think is best for them. And communication, making sure that from the time they enter to the time when they exit, it's all about them.
Okay. So I'm hearing resiliency, which is, I think every entrepreneur has that, and patient focused. What would you say is sort of like, let's dive a little bit deeper. Give me 3 or 5 things that are like, okay, this is what I mean by patient experience. This is what I mean by resilience. Help me understand those.
Right. Well, resilience goes back to when you're a student, when you're having to learn how to live your life. It's like a do or die situation. Coming from an immigrant family, you come in to U.S. and Canada. I grew up in Canada. It's a do or die situation. You got to get the best education possible for you to be able to survive and thrive. And there is no turning back. So after that, moved to Houston, and I got married in the middle of my optometry school. So I knew that I was moving to Houston. And I searched the best externship locations in Houston to be able to get exposed to the medical optometry that I've always wanted to practice, the full scope optometry that I've always wanted to. But unfortunately, when I got my license, I ended up in one of the offices where they were not practicing full scope. And I hated that. I mean, I had to beg the owner to get me do dry eye treatment for one of my patients who basically was going through chemotherapy and radiation. So my passion has been like, well, what can I do for this one patient that's in my chair? So I literally broke out of my contract within 3 months of starting with him and ended up doing relief work for at least 6 months before I landed in one of the offices that I felt that this is my place. This is where I want to be. And that we're talking about 2013. And when I fell in love with that doctor, I literally just went to him and I said, I am pre-approved. I want to work in your practice and eventually want to, buy in. And that's when 2014.
I do want to clarify for the listener that you mean you fell in love with a doctor as a boss, not necessarily as in marriage,
I fell
right?
in love with the practice and how he ran it. Dr. Wayne Maltz, I think that he is just one of the best providers I have seen in my life. And of course, I started working with him in 2013. And right when a lot of women, female optometrists, would just either quit or go part-time, or just their ambition would kind of like um, decrease a lot. Their excitement goes down, is when I got pregnant 2014 with my first child. And I went to this doctor and I said, I'm pregnant. This is a little bit for too much driving for me. Um, I either quit and go work closer, or you sell this practice to me. And at that time, I was pre-approved, and he was trying to sell his practice to another doctor who was another younger optometrist. But the practice was too big for her. So, right at the time when a lot of doctors would just kind of like worry and shy away from something like that, I went ahead and I made an offer, and he accepted it.
Oh
So,
wow.
not only I purchased the office and had my first child and love of my life, in 2014, I was also a practice owner of my first practice. Um, a lot of those things happened early on in my career as well, where I felt that, it's just do it. A lot of female optometrists I feel these days, and 40%, 50% of now new graduates are female optometrists. And guess what? They don't want to be an owner. They're just worried about let's get this one done first. Let's do A first before we do B. Or, I'm pregnant. I can't do this right now. But just one shout out to that. Like, women can do anything.
Yeah.
And having a baby obviously does not prevent you from doing anything. At best, I made really, really strong connections with my patients, mothers, patients with kids. If anything, they wanted to come back and ask me. The first question there would be like, how's pregnancy? How's the child? And now that I have my second one, and I bought the second practice in 2018, something happens, like, both of my pregnancies resulting in two of my practices. So there it is, to a lot of young women out there who feel that there's a right time to purchase a practice or start your own business. I feel that if you think in your heart you can do it, you can do it. You can make it happen. It doesn't have to be perfect.
So I guess help me understand a little bit about where that resilience and that drive might come from. Like, what made you want to grow your empire? Like, why did you go to the doctor and say, like, "Hey, you got to sell it to me, or I'm going to move"? Curious about that.
It comes from when you're kids. Being an immigrant, you come to a country like U.S. and Canada, and not only it's in your body, it's in you to work hard and to do your best and to earn your living. So it's a mix of that. You not only want to do what's best for you, but also what's best to the patient in front of you. So my mom had diabetes, type 2 diabetes, and growing up, I had seen her struggles. I was the one injecting insulin. Even though I was 13-year-old when I lost my mom, I saw the impact of her vision on her life. So I knew that I wanted to become a doctor, but I didn't know specifically at the time that, eye doctors are separate. So getting into University of Toronto and moving into Waterloo for one of the best schools in Canada for optometry. And it is one of the only English teaching schools. So I was one of the 90 kids who got accepted. It comes from that drive that you want to do the best and you want to be best and you want to strive. I taught from my experience, my first year of optometry, that I can't be the type of doctor by working for someone else. If I want to do what I want to do, I have to only achieve it with me being a practice owner. And that clearly showed up when I bought my second office as a partnership. I kind of was driven into it. I was expecting my second child after a miscarriage that was very difficult. Lost my father-in-law in the middle of 2017. So miscarriage and losing a family member was just not very easy. And 2018, when I got pregnant, the previous owner, who was now my associate doctor, ended up coming to me and he said, "Ayesha, I found this very good location for Texas State Optical. We are already owners. Let's go ahead and partner with that. And you can build the dream office that you've always wanted to build." And here's where I was always wrong. I always thought that, the grass is greener on the other side. Like, I should not have bought and established an old practice. I should have just opened a brand new dream office that would look like an Apple store, right? So that's what we did for my second practice. So now I know best of both worlds. I bought a practice that was open for 45 years, ran by a very successful doctor. And then here we were, we bought an established practice, kind of old and rusty, and we built it brand new. We invested a lot of money, had to take a loan in 2018. Well, guess what? it didn't do well. It's been 5 years now. And what I've always thought, that building a beautiful office with great white walls and furniture and the state-of-the-art technology will bring in patients, absolutely wrong. Having that traffic at my first practice, having the patient base and the trust for multiple years pays off. So I always recommend now new doctors to purchase a practice that's already established instead of opening cold start. There is a difficult kind of different pros and cons of BCA. We went above and beyond, and we invested in marketing, and however, the spark that comes with the patient flow and what you can generate and reinvest in your practice has so much more satisfaction as compared to opening brand new and then being anxious or stressful about not having enough patients and revenue to be able to run your office.
That is a great experience, share, and insight. And my goodness, that's a lot of resilience. Deaths in the family, getting pregnant.
And just last year, so this is my first year now when my partner left in the middle of all this, leaving me behind with 2 kids and 2 practices to run by myself. But being a 100% owner is definitely something that I've learned is the best thing I can do. Now I'm very, very particular and picky about partnership. But when I do, or when I am looking for partnership, it's really difficult to find those kind of associate doctors. A lot of my female optometrists are just not 100% invested in the profession and also ownership. Like, I just recently interviewed a doctor, and she wanted to get paid for a whole day, even though she's pregnant. The baby's not even here yet, and she's expecting to leave early 2 hours, that's when my working class or my patients come in. They want to come in after 4 p.m. So we're open 9 to 6. I expect my doctors to work 9 to 6. But it was one of those things that, wow, in my 10 years of life, I never expected my boss or myself just to pick up and leave early just because I'm the owner, or just because this is my office hours. That's what you have to work. Not that there is no flexibility. I take a lot of time off. We take international trips. Just came back from Switzerland. I've been to Peru, Tahiti. Like, there's so many things that you can do as a practice owner. But one thing you can't do is be 50% invested in your practice. You have to really take time out and work those hours. I can't be picking up and leaving at 3:00 when my patients are available to see me.
Yeah, that's one of the main, that's one thing that I find, I think Nathan Hayes talks about it from iDoc, similar, like, hey, it doesn't matter what model you practice optometry, the biggest controlling factor is getting the chair time filled. And that, if you can do that, you can kind of figure out everything else in the business. So you got to be available. So that's cool. That's a lot, right? So you say your business partner also left this year, in addition to all the other stuff?
So it's been 1 year,
Okay.
and the struggles have been different, but I think I have grown personally and professionally in this last year because I no longer had to rely on my partner to get anything done. Again, with partnership, I definitely want to talk about this, Ankit, if you allow me.
Yeah, sure.
My partner was in late 70s. This is the doctor that I purchased a practice from, Dr. William Luss. With all due respect, we had a huge age gap between us. My goals, my ambitions, my objectives were very different from his goals. He wanted to invest and get out of the business. I wanted to grow. I wanted to be invested for long term. He wanted me to be his exit strategy. Be careful when you partner up with people. You can't be partnering with someone who has different objectives than you do. For me, my life, my family, my 2 kids, my time, my stress, anxiety is important at this stage of life. Yes, money is important, but thank God, my husband makes good money. He works for Shell. This is not why I came into optometry and became an owner. I came because I wanted to do what I'm good at. I wanted to be my own boss and take a lot of vacations, make my own time schedule. Yes, on the days when I'm working 9 to 6, but there are a lot of days when I'm not working. And I make my own schedule. So that's the best part of optometry and being your own boss. I don't have to ask for time off. But when I'm in here fully. I'm working, I'm seeing my patients, or I'm building, vendor relations. I'm invested 100%. And that's the kind of partner you want to partner up with. You don't want someone who's too old or too young. And that's the partner I'm having to struggle with.
It almost sounds like the vision has to be the same. right? So yeah, and this guy, you
Absolutely.
have to see the same future together in terms of your businesses. So,
Right.
uh, so to help me understand a little bit. Many optometrists, almost every optometrist right now across the country, especially multi-location optometrists like yourself, uh, non-doctor costs or staff costs are going up,
Yes.
and insurance reimbursements staying flat or even going down in some cases. How are you dealing with it in your office? Any successful strategies, or maybe you're struggling with too, like everyone else, but like curious to hear your thoughts on that.
Absolutely. So this is something that I noticed in my bigger office, my first office as well, that when we purchased the office, we had to write off about 300K because the billing was so poor. The manager was not able to keep up and she wasn't able to communicate with my partner or at the time owner that we are not successfully billing. So I have struggled in these 5 year, 10 years. We have tried different billing agencies. We've tried different things, but still you cannot rely on those insurance reimbursements. Even now, like you see what's happening since February with United Healthcare and Medicare. You cannot just rely. So how do we deal with those kind of things? You have to focus on other things that can enhance patient experience, and no insurance has covered that. And I'll give you two main examples in my practice just since last year. Neurolens, which is completely insurance free, cash pay, orthokeratology, none of the insurance is covered. I've been doing it for 10 years, off label, myopia control, and now dry eye treatment, IPL and radiofrequency. I mean, I have been practicing dry eyes, building that practice for 10 years. And finally, when the radiofrequency and IPL got approved, I'm like, all right, this is great. And I cannot explain you how successful I have been in the last 2 months just by introducing radiofrequency and IPL.
Yeah, I think it's interesting because I think that's a reoccurring theme that we hear with a lot of our guests is that specialization. A lot of the folks do dry eye, myopia control. You're doing a little bit of like it's really interesting. You're even specializing in the medical side too. Sounds like I think when you and I were initially talking, you do a lot of work with ophthalmologists. So you've got that heavy medical practice too, which is really kind of neat to see. So tell me a little bit more about like what keeps you up at night right now. Like you're a very resilient person, so I don't know very much keeps you up at night. I bet you sleep really well.
I mean, it's a deep fate. I think part of it is risk taking. You know, when you
Yeah,
go purchase a practice and you're like, oh my God, am I going to be able to run this? I'm pregnant. You know, what if something happens? And what's the worst that can happen, right? At the end of the day, we're all in it for patients. We're in it for our passion that we went in for. You know, my undergrad was very research oriented. I graduated with cell and molecular biology, so very research oriented, working in a lab. And I felt that that's not who I am. I'm good with people. I'm good with patients. I think I can convince my patients about what they need and what they should do, and I connect at their level. I mean, I half of my patients are engineers and oil and gas professionals, and the other half are healthcare professionals. So they're highly educated. We're seeing attorneys and professionals at both of my practices. We're very close to, Exxon, Chevron, and Shell. So you need to first be confident about what you can do for patients, and the confidence comes from continuing education, investing in yourself, investing in your staff. So I do attend a lot of seminars and educations. I just went to San Diego for Conquilling, which is the electronic health record that we use. Um, I try to attend a lot of educational tools about dry eyes.
what's really challenging? What kind of challenges are you facing right now? Like that's kind of what I mean by keeping you up at night. Like what are some of the things that with multi-owner practice, with multiple practices, what's really what do you find right now as something that you're struggling with?
I think my biggest challenge, if you ask, as of now, is staff. Staffing has been a biggest challenge since COVID-19. Not only everyone left, but something changed in those millennials where they wanted to get a paycheck but not having to come to work. And I don't understand, what happened there. And even now, I feel that the staff cost has gone up significantly. They don't want to invest in education and training, yet they want a higher pay scale. So staff hiring, HR retention, just keeping them motivated has been the biggest challenge in the last few years.
Yeah, it's tough because inflation, right? I think there's been a lot of inflation since COVID, and so that makes it tough for sure. I think you're not alone in feeling that. I'm sure a lot of folks listening
Right. Right. And you get a lot of resumes and you look at them, and this person that you're interviewing has not stayed at a single job for more than 3 months. And
Yeah.
I get very disappointed.
Yeah. Yeah. You know, and I think they say past behaviors usually dictate future results. So that's probably someone that if you're okay with 3 months or so at your business, that's okay. But if you're not,
Right.
then may not be a good fit for your office.
I mean, my recent education or the conference that we went to, I really started thinking out loud about AI and having virtual assistants and having staff that's working remotely. I have some remote workers who work in terms of content. I have a full time videographer. We have editing team. We have marketing team. I believe in letting the specialists do their work. Right? Like I can't be everyone. I'm good at seeing my patients. And one thing that I did as soon as my partner left is I hired a general manager to help me out with everything but seeing patients. And for some doctors or owners, they may have their husband or wife kind of, manage
Yeah.
these tedious tasks, I call them. Um, but I didn't. My husband has a full time job. We have 2 kids. So unfortunately, I did not have that support other than then helping look at some of the bankings and insurance payments and all that. I had to do it on my own, and I learned it very quickly that I would rather be with my patient and generate revenue and not deal with so many doctors and training them what to do. And I'll hire a specialist or manager to help me manage both of my practices.
So that's interesting. I hear that a lot too with a lot of the guests. It's like, hey, knowing your lane, what you're good at, where you're best used, and then finding folks who are good at those things. I think that's really insightful for you. Because it's kind of what happened with my wife and I. You know, she's the optometrist. I helped her run the store. Now we have a GM at the offices, and but reason why we started my business care team was specifically because of that issue with staffing. It was tough, especially in like it seems worse in cities, but maybe I'm just that's where we are. We're in a bigger city like you are in Houston, so we're in Atlanta, so it's similar in terms of size, although you're a little bit bigger. But yeah, it feels like it's been a challenge. I don't know if it's like that. From what I thought here, I think it's everywhere like that. But
It is everywhere.
yeah,
It is everywhere like that. It's a challenge for all of us. And unfortunately, even doctors. And I don't know if you're noticing that, but my doctors don't want to work enough, or they're not invested enough, or they're not available, but they want to get paid for it full time. I just cannot believe it. Like for me, I had to prove my worth to my boss, my practice owner, that I'm really good. Like, I worked at his practice a couple of times. In my first year with him, we grew 200% on daily disposable contact lens sales. And he asked me, Aisha, what do you do? What are you saying? And I'm like, I'm just using your technology. I take a picture, I put a drop of lissamine green, I take a picture of the contact lens patient, I flip their lid, and I show them their bumps and lumps under the skin. And they purchase full year of contact lens supply that year because that's healthier for them and it's better. And the most important part, no one has talked to them about it.
that's actually a really good technique. Most doctors don't use that.
Most doctors don't do it. No, I learned that they're like, oh my God, doctor, but no one has ever worded my lids the way you did it. And you did it within a second. I do it for every single contact lens patient. And they walk out after seeing their pictures of neovascularization or like thick red, green kind of ring around their conjunctiva, and then yellow or red kind of eye, they can tell their eye is not healthy. And I'm emphasizing prevention and education. And they walk out with a prescription thinking that this is how I'm going to treat my eyes. And they come back a lot happier. They want to see me again the year after year. The other thing that I did for my practice in first year is no one was prescribing polarized prescription sunglasses. The patients did not even know that. So I had to educate my whole optical staff that, guys, everyone needs a pair of prescription sunglasses, because when I asked them, do you wear sunglasses? No. And they will have a giggle or laugh. And they're like, I have to wear my clear glasses. And I'll tell them, yeah, but you can get prescription sunglasses as well. So you have to think outside the box. Patients, for some reason, are trained to get only what insurance covers. That's the wrong way of training. I came from Canada, where OHIP only covers kids' eye exam and then patients above 65, and only 10 medical conditions like diabetes and glaucoma where eye exams are covered. So everyone is trained to pay for their services, at least for eye care.
Yeah.
But you come to US, one thing I notice is like people don't bring their kids unless something is wrong or ophthalmologist says there's something wrong, or they have an eye problem already and they're coming to you. And then they were like, I only want what's covered under insurance. And I'm like, do you really think that insurance has your best interest? Why are they covering only one pair when you really need three?
Yeah.
So my average patients go home with 2 pairs of prescription. And if they're above 45 or 50, they're going home with a pair of computer glasses as well. So optical is a big deal. And I don't know why a lot of optometrists are thinking too much about medical and not enough about optical. We all know that 70% of our revenue comes from the optical. If we're just doing a normal, simple, old-fashioned optometry, which we're not doing, we're doing a lot others. However, optical has to generate for you. So I have no idea why doctors are opening these practices that does not have an optical. I don't understand that.
It's funny. We actually viewed it as the complete eye care, right? So like it's preventative side and comfort side of the eye care with things like polarized sunglasses, things like that. So it's interesting to hear your take on that because it's hard to say you really care about the full scope of it if you're not at least letting them inform them about the
Right.
glasses and contacts.
Right. I believe in prescribing in the chair. So by prescribing a pair of computer glasses, you're taking care of their posture, their neck pain, their headaches, their overall, they're not having to tilt their chin up to see computers. So my patients come and they're 65 years old and they're not wearing computer glasses. I just sit back and I'm like, where have you been? Let me prescribe you computer glasses. And they love it. They come back the following year after year, and they're like, Dr. Butt, this is the best thing that happened in my life. I want another pair of computer glasses. That's what I wear 70% of the time, if not 90. So doctors need to be comfortable about prescribing in chair, letting them know, you're an expert in both optical, their eye health, prevention, treatment. If they needed injections, wouldn't I tell them that you need eye injection? So if they needed computer glasses, why am I not telling them that they need computer glasses? Who am I to decide they can't afford 3 pairs? Who am I to decide that they only need 1 pair of glasses and let them struggle by turning their neck up to see the computer? I should be doing what's best for them and let them decide if their pocket can afford it or not.
Yeah, we like to say it's not just break fix. It's also not chronic treatment. It's not acute. It's not chronic, but it's acute, chronic, and preventative. So that glasses, you're right. I think doctors tend to have a hesitation when you start talking more preventative and more lifestyle and comfort. And but that's it. That's amazing. That it's funny because it sounds like we both come to the same space with independent ways. So it's interesting.
Right.
So let's daydream a little bit. I'm curious if you wanted to get 3, 4, 5, 6 locations, which you might have plans for. What would that look like today? What would you do? How would you grow it? Take us inside your Ayesha's mind in terms of thinking about the business and how to grow it.
So there are a few things that I would definitely repeat, which is, like I said, I would go ahead and purchase established practice and not open a new one. Having that patient base is important. I would highly encourage doctors to purchase or buy in or open a practice where they live. That's something that I didn't do, Ankit. And I still feel that I'm missing out on that. You're not just serving that community. You need to be part of that community. You need to be living there, breathing there, going your groceries, and your medical doctors and dentists have to be in that area. And that's when I opened my Galleria practice. A lot of, I live in Sugar Land, which is a suburb of Houston. A lot of my patients or people wanted to come see me, but my practice is all the way on the other side of the town. So it's not practical to work and live in 2 different areas. In optometry, you want to be in that community. So for anyone who's purchasing, if I'm purchasing or opening a new practice, it would definitely be closer to where I live, or I would move.
And what if now you already have 2, so you already have some scale. What do you think are some of the things that you would need to address to get to like 4 or 5 locations?
I would definitely need to overcome that fear or that stress that comes with hiring staff members and retaining them. One of the 2 practices have done really well with that, but the other one is still struggling. And I think it comes with time where, I have some staff members been with me for 5 years and, again, they reach a plateau and they don't want to invest anymore. And as an owner, we just don't see the spark. They're taking too much time off or they're too. So I think I would rotate or change or upgrade my staff instead of waiting for them to just leave and go. Having backup staff or training a backup is very important. You should always be hiring faster than firing and letting people go. So firing faster than hiring. So that's what I have not done. I guess you get busy and you get comfortable in your zone. They're like, all right, such and such is doing great. Why replace her with someone? But what if you're missing on someone better? What if the task or things that you're getting done in house can be moved and something can be done more efficiently? And that's where I am at this point. That if I ever buy another practice, I would have to have more central management, more central HR.
Okay.
Billing needs to be resolved. Like I still have in-house billing after trying so many different billing companies. We went back to in-house billing. Now, what if something happens to my current billing agent? I need to have those areas resolved, and I need to have backup plans for everything.
Yeah. Yeah. Well, one of the things, so we've had a similar experience to billing. One of the things that we started doing was creating a database of all CPT codes, associated ICD-10 codes and modifiers, and based off the insurance company, what's the expected reimbursement. And that was a lot of work to put together.
Oh yeah, of course.
But that actually helped us say like, oh, we should be, this is the procedure, this is the code, this is interesting. We should be expecting this much back. What's our true AR here?
Right.
Versus our, so that, but you're right. No, it's hard to find the right billing company to help with that.
Right. I do a lot of medically necessary contact lenses, and as you may know, they cost a lot. So we have to make sure that we are getting reimbursed before we're dispensing, or we need to communicate that with our patients. So it is really, really important to know what you're billing, what you're expecting. Like Procara, the amniotic membrane reimbursements recently changed, so we have to change our behavior accordingly. I mean, in the best perfect scenario, I would just get rid of the insurance and have patients pay for everything.
That's tough though. That's not how the consumer wants to interact with the eye doctor in the U.S. It seems like that has to almost have to be in most cases, not every case. I think there are people that do it very successfully.
Right.
I don't know if I know anyone who's doing it at scale, like more than just one location. There might be. I would love to talk with them if they are. That'd be a great guest. So.
We have introduced NeuroLens, and it's been 1 year now. And I would tell you, those patients who, and including myself, I'm a successful NeuroLens wearer. And in the beginning, I didn't believe that patients would pay for it, even when they have insurance benefits. We have a lot of 40% of our patients are VSB patients. They're 20% cash. And in one of my offices, 50% are cash pay. So for them, it didn't even matter. They're like, oh, if this is going to help me either with headaches or neck pain or eye strain, go for it. It wasn't even a big deal. But one of the offices where insurance was heavily kind of dominating, they were like, well, it's not, my insurance is not covering it. So how do you deal with it? How do you prescribe a lens or a treatment option that's not covered in insurance? I think that takes skill. And if you're used to it for 10 years, talking about your insurance doesn't cover this because they don't cover gym. If you get a heart attack, their insurance would pay for that.
Yeah.
But your insurance is not going to pay you your monthly premium to go to gym. So
that's actually a great analogy. Yeah.
Yeah. So you have to explain it to them. And sometimes I get overly, casual about it. And I tell them, I'm like, do you really want to wait till things get a lot worse before you do something? Or would you want to prevent it? And if you know you're overweight, you know your numbers and you scale it. Same thing with diabetes. If you don't know your numbers, I have a lot of patients who come in and they're like, I don't know my A1C. And I was like, how can you manage something that you don't know? So first up is this is your A1C. Then I can communicate with you about what the goals should be and how we get there.
And it's interesting. And by the way, the NeuroLens does not sponsor the podcast or anything. They just happen to be something that you really enjoy to do it. I appreciate you sharing that because I think a lot of folks have had experience with that. So I think the important lesson there is unique differentiator that helps the patients, just like everything else that you're doing. It's all about the patient care, and NeuroLens right now is working for you and your patients, which is amazing. Let's switch gears a little bit. Let's talk about you a little bit more personal side of things. I like this question. It's can you give me a couple of formative moments in your life that you felt like, yeah, those are really who made me who I am today, that helped me. Like, I think that's where my resiliency was really tested or tried, or this is really when I had the switch of, I wanted to be an entrepreneur. Where it can be, you're a kid, college, even, maybe like you're a mature adult after kids. Can you give me a couple of moments that you felt really make Ayesha Ayesha?
Yes.
Think about a moment in your life that has a really strong emotional attachment that you felt made you who you are today.
So I would want to go back to when I got my optometry, testing. There was three parts to it. So the third part, maybe I can go back a little bit where I said that, female doctors or optometrists, even females in general, we wait for certain things to be done. Um, my experiences in my life has shaped me, certainly. I came to Canada when I was in grade 13, or OAC as we call it. So I only had 1 year in high school. So moving into undergrad and Waterloo, it's like do or die situation, just like it is. But then a lot of people or students, even now, will feel like, all right, we're just going to wait for this degree to finish and then we'll get married. So I got married in the second year of optometry. And most of the people, if you talk about it, this is a big no, right? Oh my God, why are you getting married in the middle of your professional school when all of your energies and your mental capacity should be focused on your school? But, I just, the couple of things that come with faith, your culture, your background, that you just do it. I mean, in my culture, girls kind of get married in a certain age and you feel that, all right, this is the right thing to do. But there are other things in your life that come, and I have this tendency to just embrace them and be thankful for it. And that's what happened with optometry practice as well. So I moved to Houston, and for some reason, the medical, the clinical side of the thing, I just kept missing it. I failed my clinical part a couple of times, and third time is when so I ended up losing my residency because of it. And normally, if it was someone, it would just be a disaster. Oh my God, I got into optometry residency, the one I wanted in the best university, and I lost it because there was a problem with me. So whether it was the slang or the language or something that I wasn't saying, or clinically something that I was missing, because Canadian boards are a little bit different than American boards. Even though a lot of my friends were able to clear it, it was a lot. It was challenging emotionally, physically, that, oh my God, I went through this 8 years of education and now I can't get licensed to practice in Houston. It took me the third part and I lost my residency. And when I eventually started practicing, I really valued my license. It was everything to me. So I would stick to the laws, I would stick to everything that, oh my God, this was hard for me to get. And then you respect it a certain way, and leaving your, of course, your wife is an optometrist, so you know that it takes a lot to get there. And then finally, when you're there, you feel like, oh my God, I have a lot more to do. So when I started practicing eventually, I hated it. I hated it because I was just a refractionist. I was just churning, prescribing glasses day in and not that that was not fun for me, but that's not who I was supposed to be. I was supposed to be treating dry eyes and medical treatment, and dry eye has always been my passion. I was awarded the most passionate student with scleral lenses and specialty lenses. So I always wanted to do that. And in that practice, I couldn't. So if it was just a nice little cute girl, I would just stick around and finish my contract. No, I broke out of it. I ended up talking to my, boss, and I said, I'm not happy here. I'm leaving. Tell me what I need to do. And he was fine with it. And then just kind of like moving on and on and on with this, just not being able to achieve what I wanted as an associate doctor. I said, all right, I have to do this or else, I mean, I would always be doing what other people want from me or expect from me. So in order to be where I am, and that's something that I had to do with partnership as well, that I wanted to do A and my partner wanted to do B. He just wanted to invest in very expensive frame lines that no one else would like because, they were very exciting, but that's not what patients are looking for these days. They either want brand names or they want something that has recognition already. So I went completely the other way. I said, no, I want dry eye treatments. And, he wanted expensive diagnostic equipment and I wanted to focus on treatments, not diagnostics. It's just something that I've learned as well, that over time you could have thousands and thousands of dollars of OCT and visual field and NeuroLens devices. But at the end of the day, patients don't care about diagnosis. They care about treatment. So isn't it better to invest in treatment options like, tear care and radiofrequency and IPL? I think that finally came to me when I invested in Neuralens and IPL and radiofrequency, that doctors have been spending or investing their money in the wrong side of the equation, which is a diagnosis. If you already have a diagnosis, what do you want to do with it? It's much better to offer them the treatment.
And so let's rewind a little bit. You had a lot of good insights here. So knowing what you know now, what would you tell yourself 4 days after graduating OD school and becoming an optometrist? Or maybe for you is whenever you got the official certification of OD, what would you tell yourself knowing what you know now?
Oh, I would get some business sense. My dad came to help me in 2019. Like I said, my husband couldn't help me. And it took me a few years to believe that my practice is not doing what I hoped that it would. Especially, when you're pregnant and having kids, you have two things of your life going side by side. You call it work-life balance, but it's not really balance. It's always leaning on one side. So when you finally hit back and feel like, all right, you want to grow now, this is what you want to achieve, I felt that I needed someone that I could trust. I needed someone who can take the doctor's jacket off and just put the owner's hat.
Yep.
That was my dad. He came to help me in 2019. So,
So you'd say to call your dad sooner to come and help you, or help get
would I sooner, family member.
Yeah.
I don't know if, your spouses can help, because I know they may have another profession like mine. But sometimes it doesn't work. I have seen certain couples work in the practice, and it actually almost what ends up happening is the staff hates the other side. Like if it's a female doctor, they don't like the husband, or if it's the husband is a doctor, then they don't like the female. And it happened in our practice as well, in a way that not my husband is not involved in my practice at all, and I like it that way. But with the previous owner, his wife was involved, and people would either hide things from her, or they would talk back in a way that that they knew that this is doctor's wife. But she wasn't as heavily invested in management as his dad was. His dad was a pharmacist, so his dad really helped. So I felt that having someone help you with the practice is important. He came, but unfortunately, he ended up with a massive heart attack. That was the day we had a grand opening of my second office.
Oh, gee.
And that was just eye-opening. I mean, I'm literally in the hospital calling my partner that unfortunately I'm not going to be able to make it because my dad is in the hospital and I don't know, he's going to have to need a surgery. I'm not coming in. So this is like grand opening of my second office. And that teaches you that, things will happen. They're meant to happen. There's nothing you can do to prevent it. I mean, the office is working fine. It's okay that I didn't attend the grand opening. But at the same time, you need to have that kind of mentality that it would be okay at the end of the day. What's the worst that can happen? Yeah. If my office is not open for another 3 days, it's okay. We can make up the next month, next year. There's always 5 years later, right? But if you don't have a practice, I don't know. I don't know what I do. I don't think I can work for anyone.
Fair enough. I think most entrepreneurs will say that. So this has been I really appreciate you sharing your stories and insights. Yeah. This is really good information in here, and good
It's funny
sharing.
that Ankit, I was in high school when I started tutoring. So no one in my family has been, like not just entrepreneur, but like if there's 12 or 10, 15 hours in a day, not like I was always productive, but that's in my blood. I love teaching. So I started tutoring for one of the companies in Canada, and the students and teachers and the parents loved it. He made me a partner. So I was a partner of tutoring for several years, even in my optometry school. And that was quite an experience. I mean, when you get at that level where you can communicate and you can tell a child or their parents, this is what your child needs. And of course, that's what we do in optometry as well, right? Your child has myopia, their eye is too long. I need to correct it to prevent it from getting longer. Let me do a couple of measurements. That's going to be my baseline. Let's start measuring, Bob's eye length, and let's bring it. These are all your options. Pick one, and we'll go with it. It's going to cost you this much. Yeah. All right, Dr. Butt, let's do it.
Yeah.
It really starts off young. My mother was a teacher. My dad taught international banking and finance. So communication, getting at that patient's level, making sure that you tell them that you care. And it's coming from that voice, that personality, that body language, and how you put things together. It connects, and your patients will come back reaching for you, even if it costs them out of pocket. Like I have patients
Who come out of network for you?
thought, yeah, we went out of network and they will still come back and they will happily pay for it. And they will wait. Yeah.
Well, thank you again. So if people want to connect with you, learn more about you, where can they find you?
So they can find me on LinkedIn. I have 2 practices, Texted Optical Bridegroom and TSO Champions. They can reach me. You can email me if you wanted me to share my email address. I can share.
If you feel comfortable with that, feel free. We'll put it in the show notes. If not, we don't have to put it in the show notes.
Sure. Yeah. No, my email address is fine. What if there is a doctor out there who may or may not share my experience? They're going through miscarriage, they're going through pregnancy, and they're not sure if that practice that they're working at is good for them. I mean, why not? I can't, I'm not an accountant, I'm not an attorney, but I can tell you that sometimes you want to share your experience with someone who may be thinking that, okay, this is not the right time. There's never a right time. I feel that now that my kids are 6 and 10, I want to spend time with them. But here I am. I already have 10 years under my belt, and I have 2 very happy, healthy children. And it's not that if I was not, a mother or a doctor, I think becoming a mother, being a female, has made me a better doctor. I connect at a better level with a lot of my parents, even my male patients. Yeah. We have stuff to talk about.
That's good. Well, thank you again, Dr. Butt, for joining us today.
Thank you so much. Thank you for having me. I think it was very entertaining to me as well.
I
mean, you made me jump back to my past, and some of it is emotional. Some of it is very difficult, going back, losing my mother, seeing my father trying his best to help me. I really want to say that, you are who you are because of your surrounding people, your family. Mm-hmm. And I think my resilience, my, entrepreneur skills, or my communication skills, and just the way I am today, it's because of my husband and my father.
I appreciate you being on the show. I feel like we could talk for a lot longer. We'd like to keep but maybe we'll have you on for another round. But thank you again, audience. If you learned anything today, please share. Please subscribe and share with your friends and colleagues. This has been another exciting episode of Optometrists Building Empires, and we'll see you next time. Thank you. That's a wrap on another episode of Optometrists Building Empires. Thanks for joining. For show notes and more, visit buildingempires.live. This show is proudly sponsored by My Business Care Team. My Business Care Team was born out of staffing challenges my wife and I faced together, managing multiple optometry locations. We refined our approach at Classic Vision Care and now offer our expertise to others. If you're experiencing challenges with staffing and you'd like to set up a discovery call, we'd be happy to help you and connect you with the right resources. We'll see you next time.